Hi, I'm going to talk about the power of high-dose IV iron, namely Ferric Carboxymaltose, FCM. It is believed that iron was born during a nuclear fusion reaction within the star. That's why stars are nicknamed as iron factories in space. So, it is believed that what sits in star is also in us. My name is Dr. Habiba Kamarul. I'm a consultant hematologist currently working in Bukit Tinggi Medical Center. IV iron, there are many brands. They are similar but not the same. They are similar in a sense that they have a central core of iron surrounded by a carbohydrate shell. But this is the carbohydrate shell is the differences between these brands. This carbohydrate shell is the trade secret. This is what determine the product, how stable are they, whether they how much labile iron they release, how much maximum carbohydrate, how much maximum iron they can give in a single dose, and also the risk of developing allergic reaction. So let's for today's talk, I'm going to focus on women. The first one I'm going to focus in women with heavy menstrual bleeding. So all these years, our advertisements has been focusing that this menstrual period is something physiological, and we should be happy with it. We should able to go outdoor and things like that. But because they are selling the tampon, because they're selling the tampon. But in truth is finally in March 2018, a group of scientists confirmed that period pain can be as painful as heart attack. Most probably, this group of scientists mostly are we are seeing more women as a scientist, right? So when they confirm this, finally people come and say yes, they felt the pain. So can you imagine not only feeling but the pain is made it worse when they have such a heavy menstrual bleed. So this is the definition of heavy menstrual bleeding. Let's look at the criteria number B. The number of tampons that you use is also to determine how heavy the patient is having the menses. But just what I would like to bring here, the point is just like our technology of phone that improving so much from Nokia to iPhone, our tampon technology also has improved tremendously in creating better absorbing tampon. Hence, there is a risk that we are masking the menorrhagia even better than before. So just bear in mind when we are clocking in our patient. So let's go back to the studies. As we know that there is a studies back in 2017 that look at 477 patients that fulfill the criteria of heavy menstrual bleeding, where one arm received IV iron, the other arm received standard treatment, which is oral iron ferrous sulfate at that time. And it's not, if we look at the result, as we all know and proven, the result definitely show improvement of hemoglobin and ferritin with statistical significance. The next study is interesting. This study took a non-anemic but iron deficiency individual with T-set of 20% and ferritin of 15%, but they have unexplained fatigue because the hemoglobin are more than 11.5. So one arm was subjected to single dose IV iron, another arm placebo. So let's look at the result. It definitely shows when they assess the fatigue, they assess the patient based on Piper fatigue scale. It does show improvement in all of the soft findings such as fatigue, behavioral, mood, and cognitive function of these ladies within the 56 days after giving the IV iron. Next studies that I would like to look is the Ferric Carboxymaltose in pregnant women. As we all know, the first wealth is the iron. So we all receive our first wealth inheritance from our mother. So iron, we know the iron-rich mother. It means that we will have the iron-rich baby. So there is in this next study, they took a pregnant woman. In this study, where they took the study design is involving a pregnant woman with iron deficiency anemia, and then they expose the one arm to IV iron, the other arm is the standard therapy at that time with ferrous sulfate. Definitely it shows significant improvement of the hemoglobin, uh, significant improvement in the hemoglobin of a rat, which is not only, it shows significant improvement in the hemoglobin and ferritin, and it is quite a rapid and effective changes. And not only that, it also showed significant improvement in social functioning. Social functioning not only 3 weeks after receiving the IV iron, but also prior to delivery, which is, I believe, it could definitely translate to a reduced morbidity of delivery, to translate to better and less risky delivery. So the other thing is, we all know, being pregnant, we all ladies in the room, we all know pregnancy time, it can be quite challenging in terms of our GI, our nausea sensation and everything. So I think on patients who are having symptoms, it's not fair to give them iron that sometimes it can exacerbate or make the symptom worse. Some good patients, they continue to taking it. Some smart patients, they stop taking it. Smart patients, they stop taking it. So we just have to be more empathy and introduce IV iron in as required. This is the next studies is the Ferric Carboxymaltose in women postpartum. So postpartum and breastfeeding rituals considered sacred in many cultures. But what I like to bring forward is that iron content of human. But what's fascinating is that the iron content of human milk remain consistent despite the maternal iron store. During pregnancy, the iron, how much the mother has iron, that's how much the baby will receive. But during postpartum, during breastfeeding is different. Thank God the milk is, the iron content is quite low. So can you imagine if a lady already has a poor store of iron and the milk need to be consistent? Usually this mother, they will be depleted of all their iron. I think that's where the risk of all those illnesses, meroyan, depression, all come into during postpartum period. I highly believe that it could be the cause for the iron. So as we know that we have but go back to IV iron, we know that ferric carboxymaltose has been extensively studied globally, but we have no paper from Malaysia yet. But we don't have paper. Well, we hope to have some papers from our country. Yeah. So that's not our flag. That's actually Malaysia. That's actually not Malaysian flag. That's the American flag. So, during postpartum, it's believed that when you give, there's a study that look at that's the study that actually deliver iron to a postpartum lady, with a postpartum lady, and they definitely, it shows improvement of the. Still, there is an old study that which is still relevant today in 2007. The study involved giving IV iron to ladies with hemoglobin of 10 within the 10 gram within the 10 days, if they 10 days postpartum, and compared to the standard arm of oral arm 3 times per day. 3 times. Okay. So the result actually shows, it's not surprising that carbon actually able to sustain the hemoglobin more than 12 in a shorter time. Very short lah. So the conclusion is, as a medical practitioner, we need to change our perspective and threshold for tolerating anemia. This is one of the ways to make sure our ladies, mother and future generation to have good iron store and general well-being.